Imagine this, a 25-year-old woman excited to meet her new baby goes in for a routine C-section. But instead of joyful first moments with her child, she wakes up unable to move or speak. Within the next 24 hours, she suffers from multiple seizures and falls into a deep coma. What went so terribly wrong? Why did she suffer this fate? Hey curious minds, welcome back to our channel. If you are new here, we spotlight the most unusual and fascinating medical cases to raise awareness and spark curiosity about health and diseases. Today, we're diving deep into a medical case that will make your jaw drop. Buckle up, because this is going to be a wild ride through the world of medication errors and their potential life-altering consequences. The answer to our case lies in a tiny vial and a massive mistake. Instead of receiving the plant medicine, our patient was given a drug called digoxin, and not just any route and straight into her spinal fluid. Let's try to break this case down. Digoxin is typically a cardiac medication used to treat heart conditions such as atrial fibrillation or heart failure. It helps the heart pump blood more efficiently and can control irregular heartbeats such as atrial fibrillation. Common side effects from this medicine can include nausea, vomiting. It can also cause some bizarre side effects such as yellow vision when the levels are too high in the blood. But here's the real kicker in our case. These are the side effects that you would typically expect when digoxin is given the right way, which is usually given orally, that's through mouth, or intravenously, which is into your vein. However, when it's given directly into the cerebrospinal fluid or spinal fluid, it's a totally different ballgame. CSF. Let's talk about this crucial fluid. Cerebrospinal fluid, or CSF, is a clear, colorless liquid that surrounds your brain and spinal cord. It acts as a cushion protecting brain and spinal cord from injury. It also acts as a conduit for nutrition into the brain. However, CSF is also a direct road into your central nervous system. When digoxin enters this fluid, it has unimpeded access to the brain and spinal cord. That is why our patient experienced such severe neurological symptoms and so quickly. Now, what should our patient have received instead? The planned medication was something called bupivacaine. This is a local anesthetic commonly used in spinal anesthesia for C-sections. It numbs the lower half of the body, allowing for a painless operation while the mother still remains awake. Alright, let's play a quick game. Can you spot the difference between these two vials? Tricky, isn't it? That is exactly why this case happened, because medication mix-up like this can happen with even the most highly experienced medical staff. Medication errors are a global health crisis. Surely this is a one-off incident. Well, hold on to your seats. Medication errors affect 1 in 30 patients worldwide. The global cost of medication is estimated to be in the billions every year. And these are not just raw numbers. Each statistic represents a patient, a family whose lives forever can be changed because of a simple mistake like this. Now let's look at how our patient fared after this catastrophic error. As you can see, there was a dramatic improvement in the coming months. However, it took many months. The brain and spinal cord are incredibly sensitive to foreign substances, especially potent medications such as digoxin that are not supposed to be there. So, how do we prevent such errors from happening in medicine? As you can imagine, there is a lot of research and effort that is underway to prevent this from happening in medicine. Here are some simple steps such as barcode scanning. Every medication should be scanned before giving it to the patient to make sure that it matches the prescription and the right patient. Physical separation. Similar looking medications should be stored separately to avoid mix-ups like this from happening. Double checking. Especially for high-risk medications like this, at least 2 healthcare professionals should verify to make sure that the medication belongs to the right patient. And then finally, even simple things such as clearly labeling the medicine with a distinct font and colors to help differentiate this medicine, especially when healthcare professionals are so busy all the time. This case isn't just about one error or one patient. It is a wake-up call for the entire healthcare system. This case highlights the need for robust safety protocols, especially in all medical settings such as the hospital, clinics, etc. Continuous education for healthcare professionals and a culture of open communication where errors can be reported without any fear. Alright, time for a quick quiz. Let's test our knowledge. Question number 1. What medication was accidentally administered to this patient instead of the intended anesthetic? Answer A, morphine. Answer B, digoxin. Answer C, epinephrine. And then answer D, warfarin. If you guessed answer B, you've been paying attention, and thank you. Question number 2. Has this video changed how you think about medical safety? Answer A, yes, I will be more vigilant. Answer B, somewhat, it's concerning. Answer C, no, I was already aware. And answer D, well, I'm not sure. Let us know what you think in the comment section below. This case of accidental intrathecal or spinal fluid injection of digoxin serves as a stark reminder of the potential consequences of medical errors. While our patient made a pretty remarkable recovery in the ensuing months, her journey was long and tedious. It underscores the importance of strict safety protocols, clear communication, and a culture of accountability in healthcare settings. Remember, as patients, we can also play a crucial role in our safety. Don't be afraid to ask questions about your health or your medications if you are ever in doubt. Your curiosity could save a life, maybe even your own. Thanks for joining us on this curious case journey. If you found this video helpful, please check out our last week's video where we highlighted a rare complication of dengue fever in a patient traveling from India. Hit the notification bell to stay updated on our latest uploads and follow us for more helpful information. Next week, we'll explore a case of rare infection with a drug called TNF inhibitor. You will not want to miss that. Stay safe, stay curious, and most importantly, stay healthy. We'll see you in our next video. Oh, by the way, have you ever experienced a medical error? If yes, then share your story below in the comments section. Thank you.